Hello everyone, and welcome to another edition of Eyecare Today. I'm your host, Dr. Thomas Kislan, and we're coming to you today from our Hazleton location, located on the Airport Beltway right here in beautiful Hazel Township, Pennsylvania. Remember, if you ever want to get a hold of us, our office number is 570-453-2020. If you're watching us in the Poconos, closer to our Stroudsburg location, our office there is 852 North 9th Street, and our phone number there is 570-421-3342. Make sure to catch us on the web at www.drkislan.com. So again, thank you for joining us, everybody. I'm very honored today to have two very special guests with me today. This story, I think, will touch a lot of people out there. We harp all the time to our patients to get regular eye exams every year. And there's reasons we do that. There's certain conditions we can catch before they become a problem. And we're going to talk a little bit today about preventative medicine as we go through the program. But first, what I'd like to do is introduce everybody to Deneen and Ed Tuggle. Did I say that right?
Yes.
Okay. Thank you very much for joining me today, guys.
You're welcome.
Ed, your story is extremely touching, and I think very interesting from an eye doctor's standpoint, because we don't see a lot of what you have every day. About 3,000 people in the United States are diagnosed yearly with something called ocular melanoma. And people may say, what the heck is ocular melanoma? And for those out there watching, it's basically cancer inside the eye when we break it down. So I'd like you to just tell your story a little bit of how this was diagnosed. I know initially you saw Dr. Scatton,
Sure.
Who's on 15th Street right here in Hazleton. I've known Dr. Scatton a long, long time. He's a great guy, great doctor. So we appreciate the care that he brings to the patients in the Hazleton area. But you saw him back in 2010.
Correct.
And so tell the folks out there kind of what he saw.
So back in 2010, I went in for an eye exam. Vision started going. So I thought I needed some reading glasses. Well, at that time, he had seen a freckle on the back of my eye, which I guess the technical term is a nevus.
Right. Very good. Yep.
So a lot of people don't use nevus. Freckle's easier. But
Right.
At that point, he said we were just going to keep an eye on it. Year after year, we'll do the annual checkups and just watch it. Fast forward.
So let me jump in there real quick. So just to let our people out there know, just like a freckle on our skin, we can get freckles inside the eye.
Yep.
And if you go to the dermatologist and they see a little freckle on your skin, they'll say, you know what, let's kind of keep a watch on it. If it changes shape, color, size, anything funky like that, we want to really be cautious about it. So it's
Right.
kind of the same thing in the eye. We can see freckles in the eye.
Right.
And same thing, we want to keep a watch on it. So that's exactly what Dr. Scatton said.
That's exactly what he said.
And what happened?
So, on a failure on my part, I did not go back for another 6 years. I had lost some reading glasses, the reading glasses I got in the beginning, and my wife was going to get her eyes checked and get new glasses, so she had made me an appointment because she knew that I had lost mine. I get back, he does a full-blown eye exam again, and did not like what he saw. Now the freckle's gotten a little bit larger, a little bit more, the discolored or whatever you see on the cameras in the test. From there, he sends me up to here to see Dr. Patel. Dr. Patel ran a series of tests on me. He did the vegetable dye and the vegetable base, whatever it is there, the dye. Did a whole full-blown another eye exam, and didn't really give me any confirmation, which I didn't have any from Dr. Scatton either. It was kind of,
Right.
nobody said too much about it. So then he gives me the paperwork when I'm done, said, we're going to send you down to Will's Eye in Philly. Now, obviously, I can't see too well because I'm fully dilated. I look down and I see oncology. Right. So I called Deneen, she was at work, and I said, hey, they're going to send me to oncology at Will's Eye. And she's like, you read that wrong. They said, it says ophthalmology or ophthalmologist or whatever. And I said, no, I'm dilated, but I can read this. So she calls back here and they confirmed it will be, they're going to send me down to the oncology department for looking for cancer,
Right.
for confirmation.
So I'm going to jump in again here real quick and just explain to the folks out there. So you know, Dr. Scatton sent you here. Dr. Patel, Dr. Sachin Patel is actually, he's our retina specialist here. And Dr. Patel basically just looks at backs of the eyes. You know, we do routine exams, treat certain diseases, but Dr. Patel only looks at back of the eye. So he's, you know, really good at looking at these things and kind of discerning. But again, because 3,000 a year in the US, we don't see a lot of these every day. So even someone who sees a lot of backs of the eyes looks at them and may not be sure exactly which way to go. And we're actually going to throw up a picture from a patient of mine actually that had ocular melanoma. We're going to put a picture up on the screen so you can kind of see what we're looking at. It looks like a brownish circle in the field of orange that you're looking at. The orange on the screen is actually the retina, and that kind of brown spot to the upper left, that's actually the little quote-unquote freckle, kind of like that Ed was talking about, that we see, that we keep a watch on. So Dr. Patel sent you down to Will's Eye in Philadelphia, and just so the folks know out there watching, Dr. Jerry and Carol Shields, and Dr. Jerry Shields doesn't practice as much, but Dr. Carol Shields, they are probably the world leading people as far as any sort of tumor or cancer in the eye. People come from all over the world to see these two, and we are so fortunate to have a facility like that, an hour and 40 minutes down the turnpike, that we can get to if we need be. So, so you got down, or you know, figured out that it was oncology you were seeing down at Will's Eye. What were your thoughts at that point?
You know, it didn't really bother me too bad. You know, in the back of your mind, you're like, cancer, eye cancer. I've never heard of it. You know, again, not too many people know of it. For me, there was absolutely no symptoms. There's no pain, there's no nothing. It just thought I was losing my eyesight because of age. So I think it was harder on Deneen because of all the, you know, phone calls and verification. But for me,
did you guys start Googling? Like, you know, patients always go online, and what were you kind of finding out? Like, what were you?
Well, I was good up until I saw the treatment with the plaque radiation. So I was like, wow, that's going to be rough. But you know, in the back of my mind, I always said there was a reason I was sent to like Dr. Scranton, then to here, and then to Will's Eye. So thank God it was small enough to where, you know, it's early detection, semi-early detection.
Right.
But you know, it really didn't. You know, I didn't go home and sit in a corner for a half hour. I kind of, let's go through the process and see where it takes us.
Okay. So the original appointment was 2010 with Dr. Scatton. Then 2016 was the follow-up appointment. So there was a kind of a 6-year gap there from when it was initially seen to when kind of the ball started rolling there. And if I'm right, you told me the original size was 2.9 millimeters in size of what the size of the tumor was when you were seeing down there.
Correct.
So to give our people out there watching an idea, 2.9 millimeters is really not that big. In the eye, it's actually large, but 2.9 millimeters is about 1/5 the diameter of a dime, actually. So it's pretty small. So you know, it's something small that we're talking about, but there can be problems with it if it grows, obviously. So what we're going to do real quick is we're going to take a quick break out there. When we come back, we're going to talk to Deneen about kind of what her thoughts were as she heard all this news, and then we're going to talk a little bit more about ocular melanoma. We're going to talk about the treatment, and that's kind of the big story here, is that you're the first person in the world to get this new treatment that Will's Eye is offering. So I think this is going to be great information that everyone out there watching is going to get. So we'll be right back. You're watching Eyecare Today, and we'll see you in a minute. Welcome back, everybody. Again, I'm your host, Dr. Thomas Kislan, and you're watching Eyecare Today. Today we're coming to you from our Hazleton location on the Beltway in Hazleton. Remember our phone number if you need to get in contact, or if you have any questions at all, please feel free to call us, 570-453-2020. If you're watching from our Stroudsburg location, 852 North 9th Street is our office there, 570-421-3342, and on the web, www.drkislan.com. So again, welcome back, everybody. We're talking to two Hazleton residents who have a great story to tell, Ed and Deneen Tuggle. If you're watching our last segment, just to review, Ed was diagnosed by Dr. Frank Scatton here in town with a freckle inside the eye, which, as some men don't do, we don't follow up very well with some of our medical visits sometimes. We let things go. And, you know, Ed went from 2010 to 2016 till he saw Dr. Scatton back. And at that point, the little spot inside the eye grew, came here to see Dr. Patel, our retina specialist. And from there, it was sent down to Will's Eye in Philadelphia, where we were diagnosed with an ocular melanoma, which, to give folks a little background, ocular melanoma is a malignant cancer that is a concern in the eye community. It's something that definitely can be a problem. Only 3,000 people a year are actually diagnosed, so it's not very common. We don't see a lot of it. It is more common in Caucasians, fair-complected, light-skinned, light-haired people, a little bit more common, and there are no symptoms. You made a great point that you really had no reason to go to the eye doctor except you needed reading glasses.
Correct.
And you had no reason to go back except that you broke your, or lost your reading glasses that Dr. Scatton gave you previously.
Yeah.
So these are things that sometimes there's no symptoms for. There's no blurry vision, there's no nothing like that. So before we get into this new treatment, Deneen, tell me your thoughts when you found out that, you know, this was possibly a eye cancer that we were dealing with. What were your thoughts?
Well, at first, it just took me by surprise because, like he said, you know, it's not something that you hear about often. And I do work in the medical field, and I still have never really heard about it. Granted, I don't work in the eye medical field, but I just so when he told me that he was being sent to Dr. Shields, I quickly Googled who Dr. Shields was, and well, first I, you know, confirmed with him that it wasn't an optometrist, it wasn't an ophthalmologist, but it indeed was an oncologist. And then I thought, oh no, wait, it has to be just to confirm that this is not what is being seen there. And then, so, you know, we got in there rather quickly. I would say it was probably within 3 weeks.
Yeah.
And for somebody for a facility that's so busy, and I mean, the whole room was filled with people when we got there. I mean, we're very grateful that we got in so quickly. But from my understanding, that's the way they are with all their patients whenever they hear of somebody possibly having eye cancer.
Right.
But so we got there, and you know, I thought to myself, okay, if this is eye cancer, still in denial that it probably, you know, I'm still thinking it's probably not. That, well, you can live without an eye. But what if it goes somewhere, you know, if it had traveled to somewhere else? That's a whole nother scary thing. And we're fairly young yet. I'd like to have several years, you know. I'd like to,
Absolutely.
you know, the fairy tale grow old, sit on the porch on your rocking chair with your lemonade. I want that.
Right.
So I was kind of scared, yeah, I have to say I was scared.
So you get down there with Dr. Shields, and you probably were there 4, 5, 6 hours, if the way it usually goes. Yeah, 9 hours. And you probably saw the resident, the fellow, and the intern, and then Dr. Shields. So what did they come out and say then?
Really, they didn't really say too much. You know, they have a bunch of iPads there stacked up, and they're looking, and they have all the interns in, and they bring other doctors in there, and they pretty much just said he's a good candidate for the study. And she and I kind of looked at each other.
They didn't use the word study though.
Oh yeah.
That was.
Or treatment, whatever they said.
Yeah.
You know, but she and I kind of looked at each other and we're like, oh, okay. Still, not too much info on what they wanted to do. So then we leave, we come back, I think the following week, and then that's when they started giving us a little bit more about this new study.
Well, wait, this is when we were in the office the first day. And she, you know, everything is very well organized there, and she's very confident. And I guess seeing, you know, as many patients as she sees, she can tell. So she said, you know, that, you know, she listed 4 options of what can be done, and the final one was, oh, I think he'd be a good candidate for the nanoparticle therapy. And of course, you know, we just said okay. And as we were waiting, we're waiting in the lobby, and I was looking to, you know, Googling what is nanoparticle therapy, and couldn't find much of anything on it. And then when we left, I still couldn't find anything on it. Then I called the American Cancer Society, who had no idea anything about it. So it wasn't until I called the office 2 days later, and I said, yeah, my husband's scheduled to have this nanoparticle therapy procedure done on Monday. And the person on the phone said, where's that at? And I said, well, it's at Shields and Shields. So then it was then that we finally realized that it was indeed a study. And, but it wasn't till then that we realized he was going to be the first person in the world to have it done.
Right. So just to give a little background also, so with an ocular melanoma, sometimes it's not cut and dry whether it is or isn't until you get down there. And again, like you said, Dr. Carol Shields has seen so many of these, they pretty much know. And then the treatment in the past has been basically where they inject something radioactive into the eye and it kills the tumor, but it also kills the rest of the structures inside the eye. And it can lead to some damage that can cause some vision loss. So even though it works to kill the tumor, you're sometimes left then with an eye that's not functioning, which is not the greatest scenario if we can avoid it. So there is a brand new treatment out there, and you said it very well, nanoparticle therapy. It actually was developed by a company in Cambridge, Massachusetts, and they're the ones that are bringing this therapy to market. And as of right now, there's only 12 patients enrolled in the study, and Ed, you're the first one, like you said, in the world to have this treatment. And when we come back from the break, we're going to talk about how your first treatment went and how you're feeling and what's we're going to do moving on from here as far as treatments or what may happen. But I think to be the first person in the world from Hazleton getting this is just an amazing thing. So again, I want to thank you for sharing your story. And again, when we come back on the other side of the break, we're going to talk exactly about what this therapy is, how it affects the patient, how it's beneficial versus what's been out there. So make sure to join us on the other side of this break. Again, you're watching Eyecare Today, and we'll be right back. Welcome back. You're watching another edition of Eyecare Today. I'm your host, Dr. Thomas Kislan. And remember, if there's any questions, please feel free to contact us, 570-453-2020 in Hazleton, 570-421-3342 in Stroudsburg, and www.drkislan.com if you want to catch us on the web. And again, I'm joined today by Ed and Deneen Tuggle from Hazleton, and Ed's story is a very interesting one. Ed was diagnosed with a tumor inside the eye that he didn't know he had, thanks to the diagnosis by Dr. Frank Scatton here in town and Dr. Sachin Patel, our retina specialist here at Hazleton Eye Specialists. We got you down to Will's Eye in Philadelphia, saw Dr. Carol Shields, who's probably the world's leading specialist for ocular oncology. And again, to give a little background, melanoma of the eye, not very common. Old treatment was to use radiation, and they insert something radioactive into the eye that kills the tumor. That can be bad because it not only kills the tumor, but it also can kill the structures inside the eye, which can lead to losing the eye, basically losing function of the eye. This is a brand new treatment that you are the first person, this new treatment, you're the first person in the world to get, where they inject a medicine into the eye and then use a laser that activates the medicine to kill specific membranes on the tumor. And it doesn't damage the eye itself. So first of all, people may feel a little funky, injection into the eye. So tell me about that.
So the injection wasn't as bad as it seemed. Obviously, they use a lot of numbing drops, and then they use the iodine, I guess, to prep the eye. They put they lay it out so nothing else can get in there. And then the injection, it lasted, I'm gonna guess, about 15 to 20 seconds. The only thing I felt was like the initial pressure, and that's all. I mean, there was no pain. There was nothing with the injection. A little bit scary, because, when they tell you, look down, look right, and don't move. you kind of get a little, uh-oh, here we go. So, but the injection wasn't bad. So after the injection, obviously my eye was, bright red from just from all the stuff that they had, the drops and whatever else they had put in there. But then you go out into the waiting room, and you have to wait 6 hours. 6 hours to the minute they came back and they took me into the room where I was going to get the laser. And at that point, she had put a protective lens in my eye, and there was a crowd of people in there. They had their laser glasses on, so I guess they wouldn't get the burn. And they had a countdown. It went right down to 84 seconds to the second, and they stopped the laser, and that was the end of that. That laser activated the drug, and here we are.
No pain with the laser.
No pain with the laser. I haven't had any symptoms of anything. You know, one time I thought, you know, with that last heavy snow we had, I was shoveling, I had a little bit of thumping in my eye, but they don't think that was due to the injection, so.
And your injection was March 6th,
March 6th.
which we said in the last segment the tumor was originally 2.9 millimeters, and you were just seen May 6th, and the tumor's down to 2.79 millimeters already.
Yep.
So in 2 months it's already shrunk, not grown, which is fantastic. So how you feeling, just in general?
I feel great. You know, like I said before I found out I had a tumor, I had no symptoms. After the injection, I've got no symptoms. My vision's actually getting better. I can see when they do the vision test, I do it at 14 meters. You know, they block one eye or the other. I have to do both of them. But I can read from the second line up from the bottom, so
Right.
it's getting really good. Before I was at the third line, so now I'm getting a little bit clearer on the letters. So
Good. When do you go back to see Dr. Shields?
I go back Tuesday, the 30th.
For a full kind of...
Full-blown checkup. They're going to do blood work, another eye exam. They'll do ultrasound again. They'll ultrasound the tumor area again, and we'll see what happens again. And
just like anything we're worried about with obviously any spread anywhere else, you've had blood work, right? You've had, you're going to be getting an MRI, I think you said.
Yep.
Because we want to check and make sure that everything else is okay. So you're scheduled to have all that done also.
Yeah, because it's our understanding that this type of tumor can actually spread to your liver, your lungs.
Right.
It can actually go. So that's the critical point. You know, you got to, and that's going to be twice a year. I'm going to have to get the MRIs and everything for a period of 5 years.
Mm-hmm.
Yeah, for the first 5 years.
Yeah, so.
Right.
But that's the one point that we want to make is, you know, he didn't go, in 6 years a lot could have happened, and, you know, it might have been too late, and because it can spread, any kind of cancer obviously can spread. So one of Ed's goals is to make people aware that it's important to get an eye exam every year, and he's just blessed that it didn't go further than this, and he was just in the right place at the right time.
Right. And I think that's a great point. I think you're right. That's absolutely why we're here is, you know, we harp all the time about, you know, kids getting checked before they go to school, and then, you know, we think about getting our kids checked, but then we hit 20, 30 years old and we see fine and don't really have a problem, so why the heck go to the eye doctor? And we harp about it all the time, but to hear you guys say it, I think is so telling, because there are things we can detect that aren't symptomatic. So yeah, if you could just kind of tell the folks out there what your message would be. The message would be to do not take an eye exam lightly. Get your yearly checkups. Take your kids, parents if they can't get there, if they don't have a way, get them checked. I mean, it's just, you'll miss so much and you'll lose so much if something is not caught early. And early detection is key with this type of tumor. Yeah, and I think, you know, you're absolutely right. Early detection with something like this, and again, because of the risk of spreading is such a concern. And with other eye conditions that aren't as serious, glaucoma can sneak up on us without us knowing, macular degeneration, these are things that can develop as we get a little bit older. So even though we're seeing fine, there might be something else going on that we have to check. So that's absolutely great. Great advice, because just because you're not, you're feeling okay, you still need to get in and get your eyes checked. I think, again, you know, a great deal of gratitude goes to Dr. Scatton for, you know, not only detecting it, but taking pictures of it. That's another thing. A lot of patients will ask, well, why are you taking pictures of the back of my eye? Because a picture tells us so more than something I could write or now type. You know, we have something to compare, so when a patient's in a year and then 6 years later, I can say, you know what, there's definitely something different there, and we need to investigate a little bit. So again, I think that's great advice. So please keep us updated as far as how things are going down the road. We appreciate you coming on and again telling your story. And I think, again, the big message going forward out there for everyone who's watching is please get your eyes checked. Even if you're not symptomatic, even if you just think maybe your glasses are okay, you haven't had a change in 3 years or whatever, get in every year to get your eyes checked because whether it's ocular melanoma or glaucoma or macular degeneration or dry eye, being proactive and finding something before it becomes an issue is so much better. It can really save things in the long run. So again, Deneen and Ed, appreciate you guys coming in. Ladies and gentlemen, you've been watching Eyecare today. Our thoughts and prayers will go forward with Ed as he goes through this journey for him and his family. Please keep us up to date. If there's any questions, please feel free to contact our office. You can see our website up there as we sign off here. So if there's any questions, give our office a call. Again, you're watching Eyecare today. I'm your host, Dr. Thomas Kislan, and we'll see you next time.